So my name is Justin Sauer. I'm a consultant psychiatrist. I work in the memory clinic at the Cromwell Hospital. What I do is to assess people's memory, and that's looking at all of the potential causes, be those some of the rarer causes or common causes such as Alzheimer's type dementia. So dementia is it's a description of a number of symptoms or a syndrome, and under that umbrella are many different types of causes of memory problem. Rare causes, but also common causes like Alzheimer's type dementia, which most people would have heard of. Sometimes it's difficult to know if we're developing a memory problem ourselves, but generally speaking, if memory is starting to interfere with those activities of daily living, that's generally a sign that probably a specialist assessment would be helpful. Also listening to other people around us, so loved ones or people at work perhaps making comments, that's the time to come and seek some advice. But it's also important to remember that all of us will forget from time to time, so it doesn't necessarily mean that there's something more worrying happening. By far and away the commonest type of memory problem or condition is something called Alzheimer's type dementia, and that is really a reflection of us getting older. But of course there are a whole host of different conditions that can cause memory problems, be those emotional problems, sometimes things like medication or other physical conditions. So it's a good idea to have a thorough assessment to exclude all possibilities. We're all at risk of developing memory problems because age is the greatest risk factor. Where there is a family history of something like dementia, we have a slightly increased risk, but there are things that we can think about doing to modify those risks. But where there really is the greatest heritable risk, that's when we have family members that have developed something like Alzheimer's disease at a younger age. There's a wide variety of causes of memory changes. Some of those are due to heritable conditions, but by far and away the greatest risk factor is related to age. And there are a number of things that we can do, and that's thinking about our health generally, protecting our cardiovascular system, learning new skills. Those are thought to be very helpful in preventing memory problems. So it's important to think about, of course, the diagnosis, and then from there the appropriate support, help, treatment and so forth, it should be available. If we're thinking about the most common cause, Alzheimer's type dementia, then there are some medications that can help with symptoms, and there is the prospect of new medications coming along soon, hopefully. It's important to have a diagnosis so that we can put in place plans for the future. And there are a number of organisations that are available that provide support to people with those sorts of conditions. So thinking about preventing memory problems in the future, it's a good idea to think about that in midlife and not later. So it's really about looking after our health generally, so making sure that we're physically fit, having a healthy diet, keeping ourselves cognitively stimulated, not doing things that are going to harm our brain, so not smoking if possible, and really drinking in moderation.